So I have a question for you. What causes an extremely painful form of arthritis that plagues more than 3 million people alone in the United States and is characterized by redness, tenderness, and is most often seen in joints like the big toe? Answer: too much uric acid. No gout about it. Happy New Year, everybody. I hope you all had an incredibly amazing and safe holiday. And the holidays actually tie into what we're talking about today. You'll see why. So gout is a common and complex form of arthritis that can affect really anyone. And it's characterized by sudden, severe attacks of pain, swelling, redness, and tenderness in one or more joints. But again, most often the big toe for whatever reason. Big toe.
Hello.
Why the big toe? I've always kind of wondered that. Poor dude. An attack of gout can occur suddenly, often waking you up in the middle of the night with the sensation that your big toe is on fire. And the affected joint is hot, swollen, and usually so tender that even the weight of a bed sheet may seem completely intolerable. So gout symptoms may come and go, but there are ways to manage them and prevent flares, which we're going to talk about in a bit. So a gout attack occurs when urate crystals accumulate in your joints. And urate crystals can form when you have high levels of uric acid in your blood, which your body naturally produces when it breaks down something called purines. So what are purines? Purines are molecules found in the cells of all living things, humans, animals, plants, so there's absolutely no way to eliminate them from your diet, which is part of the problem here. They're found most often in red meat, organ meats such as liver, seafood like anchovies, sardines, mussels, scallops, trout, tuna, and so on. And this is where it ties into New Year's. Alcoholic beverages, mostly beer, and anything that's sweetened with fructose or fruit sugar. So that pretty much does away with all mixed drinks for the most part. If you're a whiskey fan, you're in good shape. Although I don't know if that breaks down into sugar. Everything breaks down into sugar eventually, and that's why I said the holidays kind of tie into our video today, because so many people indulge over the holiday season, and then, you know, those that suffer from gout are waking up in the middle of the night with that big toe hurting. Yeah, it's extremely painful, very painful. So we're going to talk about that today. We're going to get into all the nuts and bolts and the ways that we can maybe help it and prevent these attacks and flares, and go into some of the medication that's out there to help this condition, because the alcohol part sounds just so depressing. Anyway, normally your body processes the uric acid by dissolving it in your blood and filters it through your kidneys into your urine. But sometimes either your body produces too much uric acid or your kidneys are not doing a great job of eliminating it. So when this happens, uric acid can build up and form sharp, needle-like crystals in a joint or its surrounding tissue, causing the pain and inflammation and swelling that's often associated with gout. So next we're going to talk about the symptoms. And again, gout attacks almost always occur suddenly and at night, as I mentioned earlier. And the hallmark symptom is typically intense joint pain, which can occur in any joint, really, ankles, knees, elbows, wrists, fingers. It's an equal opportunity condition. And it's likely to be most severe within the first 4 to 12 hours after the attack begins. So this will be followed by lingering discomfort, which can last for a few days to a few weeks. But later attacks are likely to last longer and affect more joints. So as attacks become more frequent or severe, they can actually lead to limited range of motion as it progresses. And ultimately, you may not be able to move your joints as well as you were before. So this is why we want to manage it right out of the gate. You know, as soon as you have your first attack, you want to seek medical attention. So what are some of the risk factors that can potentially lead to gout? Is this an unlucky lottery that leads to your body just naturally producing more uric acid? Or are there other factors that can increase your odds if you're already predisposed? And the answer is both. So factors that increase the uric acid level in your body include eating a diet that's rich in red meat and shellfish and drinking beverages that are sweetened with sugar, as I said before, which all increase your levels of uric acid in the body. If you're overweight, your body naturally produces more uric acid and your kidneys have a more difficult time of eliminating it. Medical conditions like untreated high blood pressure, diabetes, obesity, metabolic syndrome, and heart and kidney disease. And a side note, I know a lot of you out there are probably going, what is metabolic syndrome? So what it is it's a cluster of risk factors that include excess abdominal fat, insulin resistance, elevated glucose, low good cholesterol, high bad cholesterol, quote unquote. Certain medications can also cause gout attacks like low-dose aspirin, and some used to treat hypertension, including thiazide diuretics like Lasix, ACE inhibitors like lisinopril, and beta blockers like propranolol. They can all increase uric acid production. So can the use of anti-rejection drugs prescribed for people who have undergone an organ transplant. Also, a family history of gout always plays a role, and it can make someone more likely to develop the disease. Gout also occurs more often in men, primarily because women tend to have lower uric acid levels. But after menopause, women's uric acid levels approach those of men. So men are more likely to develop gout earlier in life, usually between the ages of 30 and 50. Recent surgery or trauma can sometimes trigger a gout attack as well. And then lastly, some people receiving a vaccination can also trigger a gout flare. So one of the biggest concerns is that people with gout can develop more severe conditions, which also include recurrent gout. So the thing is, some people may never experience signs and symptoms of gout again after their first attack, but others may experience gout several times each year. And if left untreated, gout can cause erosion and destruction of a joint. And this can lead to advanced gout, which may cause deposits of urate crystals to form under the skin in nodules called tophi. So tophi can develop in some of the same areas that the condition first appears, such as your fingers, hands, feet, elbows, and even the Achilles tendons along the backs of your ankles. They're not usually painful, but can become swollen and tender during an actual gout attack. And finally, we need to watch out for kidney stones. Because these crystals can collect in the urinary tracts and lead to kidney stones, this just adds to the pain. So naturally, if your kidneys are responsible for eliminating the uric acid, then you can see where, some of these issues might result in kidney stones as well. So I've been told that kidney stones are actually the closest to childbirth pain that somebody will ever get to. I mean, I've had 3 kids and I had no pain with all of my deliveries, but that's due to the lovely world of anesthesia and epidurals all 3 times. So I can't really relate, but I've been told that is the case, that kidney stones are just as painful as childbirth. I can see it. It's not foreign to me. I can definitely see that. Okay, so how do we diagnose gout? Usually it will be based on the symptoms and the appearance of the affected joint, but there are tests to help with this, and these can include a joint fluid test, basically where a needle draws fluid from the affected joint and looks for urate crystals under a microscope. And certain blood tests can also be done to look at the levels of uric acid in your blood. However, these can be misleading. Some people have high uric acid levels but never experience an attack. And some people may have signs and symptoms of gout, but don't have unusually high levels of uric acid. So this is where a thorough history and physical come in. X-ray imaging and ultrasound can also be done to rule out other causes of joint inflammation or look to see if crystals are present. And finally, your doctor may order a dual energy computerized tomography, or DECT, which combines X-rays taken from many different angles to, again, visualize urate crystals in the joints. So ultimately, how do we treat it? Gout medications basically fall into two categories and focus on two different problems. The first type helps reduce the inflammation and pain associated with gout attacks, and the second type works to prevent gout complications by lowering the amount of uric acid in your blood. So which type of medication is right for you depends on the frequency and severity of your symptoms, along with any other health problems that you already have pre-existing. Specific drugs used to treat gout flares and prevent future attacks include non-steroidal anti-inflammatory drugs, or NSAIDs, which include Advil, like over-the-counter stuff, Advil, Motrin, ibuprofen, naproxen sodium or Aleve as well as more powerful prescription NSAIDs such as Indomethacin or Indocin, Iverbex or Celebrex. The thing to be aware of with these NSAIDs is that they carry risks of stomach issues, stomach pain, bleeding, and ulcers. So if you have any of these conditions, be very careful and make sure you consult with your physician or NP prior to taking any of these if they're over the counter, or if you're prescribing them to any of your patients. These are some of the things that we need to look out for with NSAIDs, of course. Colchicine is next and is an anti-inflammatory drug that is very effective at reducing gout pain. The problem, however, is this effectiveness can be offset by side effects such as nausea, vomiting, and diarrhea. It seems like that's like the triad of most side effects: nausea, vomiting, and diarrhea. But you know, the trade-off is you're not in pain. So I don't know what would be worse, actually. I mean, I would think that I would think the pain would be worse, but I don't know. Anybody that has any experience with any of these medications, drop a comment below. I'd be curious to know. So next are corticosteroids such as prednisone, and these may also control gout inflammation and pain. But of course, there's a catch with this too. It can cause mood changes, increased elevation in blood sugar levels, and elevated blood pressure. So again, do the benefits outweigh the side effects here? Steroids can also be injected directly into an affected joint, so that may be a preferable alternative to taking them in pill form. And if you experience several attacks over a year, or if your gout attacks are just maybe less frequent but super painful, you may need to take medication to reduce your risk of gout complications. So if you already have evidence of damage from your gout on joint x-rays, or you have tophi or chronic kidney disease or kidney stones, then medications to lower your body's level of uric acid may be recommended. Meds that block uric acid production include allopurinol and febuxostat or Uric, and they help limit the amount of uric acid your body makes. Side effects of allopurinol can include fever, rash, hepatitis, and kidney problems. Febuxostat has side effects of rash, nausea, and reduced liver function. And it can also increase the risk of heart-related deaths. So again, very serious considerations when it comes to taking or prescribing these medications. Medications that improve uric acid removal, such as probenecid, help improve your kidney's ability to remove uric acid from the body. So one blocks uric acid production, which is one of two main causes of gout, and the other helps the kidneys with removing this by improving the kidney's processing and excretion. So it all comes back to uric acid, really. Side effects of probenecid include a rash, stomach pain, and kidney stones. So there are ways to take control of gout and manage the pain associated with it, including a few home remedies that are helpful, which I'll be talking about in the next video. So I'll see you over there.